In 2016, over 4,600 individuals in Pennsylvania lost their lives due to overdoses. And that's approximately a 37% increase from the year before, which also had about a 37% increase from the year before that. And so this is in concert with other states and what other states are seeing in terms of the number of opioid deaths, and really throughout the United States.
There are now on the order of 10 million people in America who are regularly using opioids. Each of them is a person who has a physician and a healthcare team. And we're not going to win this battle against the opioid epidemic without doing it one person at a time. This is a medical disease, and it needs to be treated like that. It needs a whole team to help each individual patient recover.
The Prescription Drug Monitoring Program is a very important program in this whole effort. It allows physicians to be able to monitor their patients and to see if patients might be quote-unquote doctor shopping, going to different physicians to obtain prescriptions. And it also allows us to monitor the prescriptions for these controlled substances.
For most patients, it's going to be negative. It's not even an issue. But for that small percentage of patients that do have a possible problem or interactions with other drugs, it could be life-saving. And addiction's a big problem in this country, and you don't want to be contributing to that.
All of my patients are very aware of the problems with opioids and the opioid crisis that we're in right now. So that's not a difficult conversation to have. So the PDMP is part of the regular flow, and they understand that. In addition, urine drug screens, maybe pill counts, these things are all work together so that we can get the best handle on managing their pain.
Anybody that's interested in the care of the patient can do it, and we can ask for help, and that way I think it also embraces that teamwork kind of role too.
I did try it out myself, but normally I do delegate that task to a trusted assistant, my surgical assistant, or my office manager. In less than a minute, you can get on, get the information you need, and it actually probably saves time in the long run.
The PDMP has allowed us to utilize a pretty efficient system. And so what that is in our practice, we use delegates. So we have all the clinical staff. They are delegates for all of the providers, all the clinicians. So there's cross coverage. And so that's pretty easy to train the staff with, and that's been working very well.
I think it's a great tool because it takes away some of the guesswork with dispensing a safe prescription. And now pharmacists have that clear data that they can talk with the patient about when they check the PDMP. It goes less from a pharmacist saying, I have a hunch, more to here's some real data, and this is how we can lead into a conversation to say, why is this happening? Why are they using too much? What other problems could there be that the pharmacist can actually help with? Now that the system is in place, I think it really bolsters the things that pharmacists can do in the outpatient setting, and it really integrates the pharmacist within a collaborative healthcare team. There's not a whole lot of examples of pharmacists, at least in the outpatient setting, that have access to a lot of health data from patients. And so this is a really nice way in which a pharmacist has information that everyone else does, can share that and help the team make decisions and route patients to where they need to be.
The Department of Health has been collaborating with our other partners, the Department of Drug and Alcohol Programs and the Department of Human Services, on providing more access to treatment for patients who suffer from the disease of addiction. And then we're expanding treatment options, and that can include inpatient treatment, detox and rehab, but also include outpatient treatment, particularly outpatient treatment with medication-assisted treatment. And these are medicines which, used with counseling and with case management, can offer the best hope for patients to have a recovery. And I think that message of hope is absolutely critical.